normally, the heart is mostly located on the left side of the midline. Okay? That is why it takes almost a whole lobe of the lung, of the left lung. So the left lung, you will see, has 2 lobes only. So the middle lobe is gone with the wind, not there. Okay? The right side does have all 3 lobes. So the heart is taking the position this way. Apex to the left, okay? And most of it is towards the left side of the midline, okay? And just a little part, small part on the right hand side, okay? So that's the normal position. This is the base of the heart, okay? So how do we understand how to dissect and how the heart is put together? By some basic information, okay? Always think what is going away from the heart equals artery, okay? No matter what type of blood is in there, it doesn't matter, okay? What goes versus the heart starts with a V, it's a vein, okay? So anything that brings blood towards the heart, okay, is a vein, or even lymph. It doesn't have to be blood. All right.
It's referred to as venous or arterial. Really? It's referred to as arterial or venous if it's lymph.
Yes.
Oh, I thought it
but
blood.
We don't say that there is no lymph coming out of the heart.
Okay.
Okay. So the thoracic
You're ruining
duct
my video.
actually is a venous, whatever goes versus the heart. That's a big concept. Okay. Now, to understand how the heart works, the heart is a pump. So the pump actually takes something, whatever it is, fluid, okay, moves it inside itself, turns it around, and pushes it up with or out with a very strong power. That is the purpose of the pump. And I always give my students this little example. If you have a land and it's higher than the water source, how can you bring the water up? Use a pump, yes? Okay? So the pump technically has a container of some kind, a tube or what have you, okay? And the water goes, or the fluid goes almost passively, okay? There's no movement there. There is no pressure there. That's the word I want you to remember, pressure, okay? Now it takes the water or the fluid in, the pump that is, okay, moves it from one area to the other and pushes it up or away with a very strong power. I'm going to use here the word or the term pressure. This is exactly how the heart works, okay? It takes from the back, brings it in, moves it from one area to the other, pushes it up all the way from the anterior surface, which tells you that whatever goes towards the heart from posterior is a vein. What comes out of the heart from anterior is an artery, away from the heart. That is why the most important thing to identify so you can understand how the heart is structured is to identify the anterior from the posterior surface. That's number one. Okay? And nature is giving you all those clues. You have to follow them. Okay? So here are the clues. The first thing to identify is the anterior interventricular sulcus, which tells you that this is the landmark. Right underneath there is the interventricular septum. What's the interventricular? Between the two ventricles. Okay? Separates the two ventricles. Agree? Mm-hmm. All right. Now, what else is important to identify the anterior from the posterior surface? The apex of the heart. Remember, this is the normal position. So it has to be to the left of the juice. Okay? Yes?
Can you say that last part one more time, please?
No. So the apex of the heart has to be to the left of the interventricular sulcus. Now, the importance of the interventricular sulcus doesn't stop here. Because if you know that the heart is supplied by coronary arteries, okay, the word coronary tells you the whole story. Because a corona in Spanish is technically a crown. Okay? See how my hands are going? So the coronary artery go around the heart between the atria and the ventricle, the upper chambers and the lower chambers. I know some of you must not believe me, but I can prove it to you right away. Okay? If you start from here, for instance, okay, many parts. I go by the anatomy. Here is the descending. By the way, we call this the left anterior descending, the lad. You can stop here. Okay, but it's not your lad, by the way. All right, it's usually your enemy, and I'll tell you why in a second. Sometimes they call it the left anterior descending, or it's the real name, the left anterior descending coronary artery. Okay, and the worst name of all, which actually the real name of it is the widowmaker. Because once this one is clogged, there is massive death. Okay? Why? Because this, as you can see, supplies the left ventricle. Okay? What do the ventricles do in the pump? They push out the blood. Yes? The word push here, take it away and put pressure. Because when the left ventricle pushes out blood, this is what we call the systolic pressure. Okay? When this ventricle relaxes and chillaxes, okay, to receive blood from the upper chambers, okay, this is the diastolic pressure. Does this go up to zero? No. If it goes up to zero, the heart will stop immediately. All right?
Mm-hmm.
Because the heart cannot work without pressure gradient. That's the word I want you to remember for the rest of your life. If you remember what happens with osmosis, okay? Pressure gradient from high to low. I always give my students this example to remember. Where does the water go normally? From the waterfall to the river, or from the river to the waterfall? Common sense. Yes? From high to low. Yes? Now, if you want to bring it up to the mountain, what's going to happen here? You need a pump. Yes? Or you need to go against gravity. Yes? Against normal. This is what active transport is about. Okay? And I'm sure you remember this from your first chapters. Alrighty? So, having said that this is the most important landmark here, and this is the apex number 2, now we are going to see if our theory is correct, that anteriorly you have arteries and posteriorly you have veins. Alright? But before we get into that, let's know the difference. Okay? What is the function of artery? It's to push, to have a high pressure, and to move all the blood all the way to all cells of the body. That's the function of an artery. Okay? When you measure your blood pressure, or any blood pressure, what do you occlude? You occlude the veins or the artery? The artery. Because you want to measure the pressure in the artery. This is a vital sign, by the way. Whenever you go to the doctor, any doctor, even a psychiatrist, he has to check your blood pressure. Okay?
Only if he's administering meds, right?
Hmm?
Only if he's giving you meds, right?
No. Number one, as a medical assistant or a nurse in a clinic, you must check the vital signs. The most important of which is blood pressure. Okay? So, because if you don't have blood pressure, you're not there. Or if you have low blood pressure, that's a problem. I have to seat you in a different way. Or if you have hypertension, I also have to notice this immediately before you even talk to the doctor. Okay? So those vital signs are basic. Basic. That's the most important, and this is the one that we're going to talk about today. Okay? Now, why don't we measure the systolic blood pressure from the right side.
Does it push out the blood?
It does. They both have the same function.
Mm-hmm.
But here is the difference. Here's the difference. Okay? The left ventricle sends the blood to all parts of the body. Which means, here is the important word, supplies, put so many lines underneath this, supplies all cells of the body with oxygenated blood. Okay? And this is the start of the systemic circulation.